recording, and we'll get started with our esteemed speaker in just a moment. I'm going to let a few more minutes for people to trickle in, and then I'll introduce Kathy Gerwig, and we'll get started with this talk. Okay, we've reached the 12 o'clock hour. So in interest of getting through everything we want to talk about today, I'm going to go ahead and kick things off. So thank you for joining us for the third in our four-part climate lecture series, co-sponsored by St. Luke's Sustainability Program and the Idaho Clinicians for Climate and Health. Special thanks, as always, to our IT wizard, Michael Hobson, who came in and saved us when we couldn't hear anything earlier this morning. We have an outstanding speaker today. They say don't meet your heroes, but I'm super excited to meet one of mine. Kathy Gerwig is the author of Greening Healthcare: How Hospitals Can Heal the Planet, which examines the critical role healthcare organizations can play in addressing climate change and environmental threats to health. Kathy served in national executive roles during her 26-year tenure at Kaiser Permanente. As Vice President and Environmental Stewardship Officer, Kathy was responsible for the Enterprise Sustainability Program. Under her leadership, Kaiser Permanente became widely recognized as an environmental leader, and in 2020 became the first U.S. health system to be carbon neutral for operations. Today, she's a pro bono senior advisor to Healthcare Without Harm on climate and health, and participates in the National Academy of Medicine Action Collaborative on Decarbonizing the Health Sector, and also serves as the vice chair of the board for the Center for Environmental Health. Please join me in welcoming Kathy Gerwig. Kathy, we can't hear you just yet. Hang on one second. Let me see if we can fix this tweak.
Just a moment, folks. After I was received those kind accolades from Dr. Sims, now all eyes are on me, and he jinxed it. Please hold.
Sorry for the technical difficulties. Kathy's going to do the old log off and log back on and see if we can get her audio working. It fixed our problem earlier today, so let's see if we can make it work again.
How about now? Able to hear me?
Excellent, Kathy. Thank you for your patience. We'll let Kathy take it away.
Great. Thank you. Thanks everybody for hanging in there. So what I wanted to do with you today, and thank you, Dr. Sims, for the very kind words. I wanted to talk about the interrelationship between climate change, health, and healthcare. Healthcare is connected to climate change in ways that lots of people in healthcare don't fully appreciate. And I want to explore those connections, the important role you can play in addressing climate change. And with that, let's just get going. So first and foremost, to ground this work, it is grounded in health because climate change is a health calamity. And excuse me there. It has also a multiplier effect. And what I mean by that is that it makes existing health conditions worse. So here are the health effects that are occurring today. The deadliest impact of climate change is heat. Heat waves occur more frequently, they last longer without sufficient cooling at night. And I understand August was one of the hottest ever recorded in Boise. So I'm sure you all know exactly what we're talking about when we discuss it as a health issue. Next is air quality, which is worsened by warmer weather and wildfire smoke, and poor air quality, of course, results in respiratory illnesses such as asthma. Air pollution is important to think about because it is a great opportunity to get short-term health benefits locally, because as we reduce emissions that are responsible for climate change, in communities where they're near roads and ports and other places where there's a lot of local pollution, these climate actions can truly help those communities. Next is severe weather. And we know as we see catastrophes like superstorms and floods, long-term droughts, wildfires, these cause injury, death, and property destruction. They're vector-borne illnesses because mosquitoes and other insects are now thriving at elevations and latitudes where they weren't seen before. And that means that many more people are exposed to the pathogens that come along with those insects. There's food and water contamination. Yes.
I'm sorry, one more interruption. When you logged off and on, we lost your slides. Would you mind resharing them for us?
I'm sorry about that. Let's see.
No problem at all.
Okay.
That's perfect. Thank you.
Okay. Great. So if you're hanging with me, we talked about heat, air quality, severe weather, vector-borne, and just a couple more. Food and water contamination are creating enormous health problems. Pathogens such as salmonella occur more frequently at persistently higher temperatures and with higher rainfall. Food scarcity is important because droughts and severe weather impede crop production, and that results in hunger, malnutrition, and population displacement. There's mental health trauma, and I'll close on that note because the severe weather events and heat waves are associated with immediate trauma, but there's the longer term despair resulting from an uncertain future, and that's particularly impacting younger folks today and is a serious health effect. So not only are these health effects occurring today, they are getting worse each year, and the projections are quite dire unless we take action to effectively curb greenhouse gas emissions. I wanted to quickly share a snapshot from a helpful site that, and you may have heard about this from a prior speaker, but it shows climate-related hazards across the US. And you can find it on the website that I've got on that slide. And what I did is I'm showing Boise here and Idaho in the center of this. And what you can see on this particular map is that a lot of Idaho is in moderate to severe drought, with some areas actually in extreme drought. And on the right side, it shows wildfires in the last 30 days. So if you're looking for resources to help you appreciate the current impacts of climate change in your area, that's a good one. I'd like to talk about the inequities of climate change. Health effects are especially devastating for people with higher existing health threats, the elderly, children, people with chronic conditions or disabilities, and those living in low-income areas or communities of color. And inequality that comes from social injustice increases the exposure of these disadvantaged groups, and it increases the adverse effects of climate change that they experience. This inequality also increases the group's susceptibility to damages caused by climate hazards. They live in areas that are often not as well protected or resilient. And inequality decreases their relative ability to cope with and recover from the damages that they suffer. So that all was about climate change and health. And now let's talk about climate change and health care. And healthcare, it turns out, is a big part of the problem. We are huge emitters of greenhouse gases. And in fact, if healthcare was a country, it would be the 5th largest emitter of greenhouse gases in the world. Almost 10% of greenhouse gas emissions in the US come from the health sector. And another connection is that healthcare is burdened by climate change. There are a number of ways that we're severely impacted as a sector. And let me just briefly go over these. The first is infrastructure. So in 2017, there was a wildfire in Northern California that shut down the hospital, forced an emergency evacuation, and that hospital remained closed for more than 2 weeks while all of the supplies could be replaced and the facility cleared of smoke. That was the first time in the country that we're aware of that a major hospital was closed due to a wildfire. That was 2017. Today, huge wildfires are regular occurrences in the US. In fact, that hospital has evacuated 2 more times since then due to wildfires. So this is something now that in the US hospitals have to anticipate and respond to. Another burden is that hospitals are overwhelmed when there is a catastrophe. The spikes that occur in patients suffering from physical or mental conditions following catastrophic events like storms and fires and smoke. These are all happening more and more frequently and can overwhelm the ability of hospitals to respond. Thinking about the supply chain, many of you remember Hurricane Maria. That was a hurricane that devastated Puerto Rico in 2017 and damaged a major production facility of IV bags for saline. And that shortage of saline bags lasted for months. Investor concerns might surprise you for being on the list, but for healthcare that's part of investor-owned systems like HCA and others, investors have been stepping up their demands to understand the financial risks to climate change, and they have expectations of the companies they invest in to mitigate those risks. And in fact, the Security and Exchange Commission it has a proposed rule, and if it's passed, it will require all publicly traded companies to disclose their climate-related risks and their greenhouse gas emissions to investors. And last item on this list is the impact on staff. You are all very aware of burnout and staffing shortages that are widespread in healthcare today, climate change adds to those vulnerabilities. One example is that wildfire in California that I mentioned a minute ago. It had a catastrophic impact on the hospital staff. At that one facility, more than 200 employees and physicians lost their homes. Many more had their homes severely impacted. Those individuals were both caregivers and they were victims of that disaster. The trauma that they experienced is repeated in every community that has a climate exacerbated event like a storm or heat wave or fire. So experiencing those types of events can cause significant distress, can contribute to more mental health issues as anxiety disorders and depression rise. So I want to anticipate two questions that you might have. The first is it too late? Isn't warming already so well on its way that we have to give up taking action? And I would say the answer is absolutely not. It is not too late. While the planet is already warming, absolutely, every single reduction in greenhouse gases that we make will limit the damage in the future. If we do nothing, we are certain to cause the most catastrophic consequences for our children and grandchildren. Just think about a baby born today in your hospital. They'll be 28 years old in 2050. And will your town even be inhabitable when their children are that age? So we have to take action. The second question is, will my individual action or the action just at my facility make a difference to this global problem? And that answer is yes. Again, every reduction in greenhouse gas emissions helps, but it does require collaboration, partnership among public health and public and private sectors, civil society. All of us need to work together to make the gains that are necessary. And your personal actions and your voice can contribute to that better future. And we'll talk about that a little bit more in just a moment. So let me do a little bit of a primer on what decarbonization in healthcare means. First and foremost, for all of you, it's important to understand that this is based in science. So to avoid the worst consequences of climate change, we must limit the global average temperature rise to below 1.5 degrees Celsius from pre-industrial levels. The only scenario in which that's possible is if we reach net zero emissions globally by 2050 and make a 50% reduction by 2030. So those are what's known as science-based targets: zero emission by 2050, half of that by 2030. And this is a chart that I don't expect you to really focus on too much, but I wanted to just give you a little bit of the vernacular around how we think about the greenhouse gases that are contributing to climate change, because this then will lead us to how we can help solve the problem. So the way to think about it is that greenhouse gas emissions are divided into three scopes. And scope one, which is the center green line on this chart, it refers to the direct combustion of fossil fuels that are happening at the facility. So the boilers, backup diesel generators, fleet vehicles, anesthetic gases used, those are all examples of greenhouse gas emissions that are owned and controlled by your organization. The second scope, scope two, is the simplest. It's the gray bar on this chart, and it just refers to the emissions that are associated with the purchase of electricity. So if you think about where your electricity comes from, the emissions physically occur at the power plant where they're being generated, but they're part of an individual organization's energy use because you can control how much electricity you're using. And this one's easy to get your hands around because you can find this information on your utility bill. So that's scope one and two. Scope three are the two purple lines that are on this chart. And They include 15 categories, both upstream and downstream. So if you think about the much broader, not just at your facility with what you control, but these are all the emissions that you influence because of the type of operation that you have. But you don't have to worry too much about all 15 of them. There are actually two on this chart that are most important for healthcare organizations. One is purchased goods and services, so the stuff you buy. And the other is investments. So investments through pension funds and other resources that healthcare organizations have, how they invest the money is an important contributor to greenhouse gas emissions. So that really narrows the effort from it feeling like an overwhelming problem to there are just a couple of areas we really need to hone in on. The other kind of last slide on this, diving into how we think about greenhouse gas emissions, is to know that these three scopes, they are not evenly distributed in healthcare. The best estimates are that scope 1, if you remember, direct emissions, that's about 8 to 10%. Scope 2, the purchased electricity, that's about 10 to 12% on average. But scope 3, this is the one that's hardest because you don't directly control it, you influence it. It makes up the balance. So we're looking at 75 to 85% of greenhouse gas emissions that are caused by your organization being in this category of scope 3. While it is very challenging to address, we absolutely must begin to tackle it now if we are going to avoid the worst effects of climate change. So let's talk about what to do. What are the actions that at a system level need to be taken in healthcare? And this is true for really any sector. But the first and foremost is to set a target of zero emissions. Set a target to cut emissions by half by 2030 and to achieve zero emissions by 2050. This again is based in science. There's something called the Science-Based Target Initiative, and they've determined what's needed to avoid, again, the very worst consequences of climate change. It's of crucial importance for this goal to be adopted because it is the only goal that is commensurate with the health crisis that is associated with climate change. Once you've adopted that target, the second step is to understand your emissions. How do you know how to solve the problem until you know what you're dealing with? So understanding your emissions means you conduct an inventory of emissions. You can get that again on your facility operations and the energy you use pretty easily. And then there are your value chain emissions. This again are the products and services you buy and the investments that you make. For products and services, you can actually do kind of a quick calculation. There are converters that are available where you take the spend, what do you spend on supplies, and you can convert that into greenhouse gas emissions. And you can begin to start targeting where you're getting the biggest emissions through your supply chain. And again, working through investment, there are tools available to be able to calculate the greenhouse gas emissions resulting from your investments. And then when you've got the goal, you understand your emissions, then you need to prepare and execute an emissions reduction plan, and it needs to cover all scopes 1, 2, and 3. There are some areas that your facility directors, engineers, operations teams can lead. I won't spend a lot of time on these topics, but happy to explore them more in the Q&A if you're interested. But just to put it on your radar that these are the things that are happening throughout the country at healthcare organizations to reduce greenhouse gas emissions significantly. So first is the green and resilient buildings. That means cutting energy use through efficiency and design initiatives. Pursuing LEED certification for existing new buildings is a great way to do that, including IT centers, which can be huge energy hogs and ripe for energy efficiency. So it's really important to make sure we're not wasting energy, because when we move to the next topic on this slide, renewable energy, you want that renewable energy to be used in the most valuable way. So first and foremost, be efficient with the energy that you're using, and then move to renewable energy. And that means investing in renewable energy through on-site as well as off-site solar and wind installations. For the offsite arrangements, there are financing tools that make offsite purchases feasible to own a piece essentially of a solar array, for example. And then the other area that hospitals use a lot of natural gas for their heating and cooling, and transitioning to renewable energy such as geothermal, hydrogen, biomass. This is a huge topic in the healthcare sector at the moment to reduce the natural gas that is used by many. And the last item on this list is fleet vehicles. So they count under your Scope 1 emissions, and transitioning to zero emission vehicles is what the VA is doing actually. And they've begun to transition. They have a fleet of 23,000 vehicles, and the Veterans Administration is moving them into zero emission vehicles as we speak. And then another area to touch on here, again, won't spend the majority of time on it, but want you to know it's a major focus of climate action, is what your supply chain and procurement teams can pursue. So first, I like to ask people to identify their top 20 suppliers by spend and ask them to set zero emission targets. So if your organization is setting that target, ask your suppliers to do the same. The good news is that many major healthcare suppliers already measure and disclose their emissions. They are absolutely feeling the pressure of their investors and some of their biggest customers. So you can, your supply chain folks can join in those conversations. And then next is to identify areas for collaboration to reduce the supplier's emissions. Again, this is in that Scope 3 category. You don't control it, but you can influence it. So talking to your top suppliers about what they're doing, what their barriers are, what are their pain points, how can your organization as a purchaser help? Working that through with them can help them reduce their emissions, and that in turn reduces your own Scope 3 emissions. And then ideally, show a preference for suppliers who are reducing their emissions. If you've got suppliers who have adopted a target, they're publicly disclosing their emissions, and they have those reports third-party verified, that's worth rewarding and giving them your business, assuming all the other criteria of quality and selection are being met. So let's now spend the balance of our time looking at actions that clinicians can support or lead. And first, I wanted to talk about some challenging current paradigms within healthcare. Prioritizing high quality, high value healthcare is an essential part of climate action. There's a lot of low value care that's inefficient, it's unnecessary, and many of you are already working on these initiatives because it's part of your quality agenda, but also appreciate that it's part of a climate action agenda to eliminate care that's not necessary, to reduce unnecessary pharmaceutical use, and so on. Secondly, focus on preventing illness. Reducing the burden of disease also reduces the healthcare climate emissions that are associated with treating those diseases. So a prevention focus as opposed to solely a treatment focus is an important climate action. I love it when I see organizations link their climate action with their quality initiatives. And just as I mentioned a moment ago around, high quality, high value care is a quality agenda, so too is it a climate agenda, and including greenhouse gas emissions data on your quality dashboards, for example, as part of what your leadership teams and boards look at. That's an excellent strategy. And then making the most of telehealth. Patients and providers have learned a lot about telehealth during COVID, and let's continue to capitalize on how you have been able to deliver great care remotely. And in terms of some other more specific clinical opportunities. So let's talk about waste anesthetic gases and anesthetic gases in general. These can account for 5% of a hospital's greenhouse gas footprint and as much as 51% of an operating room's greenhouse gas emissions. The anesthesia of one mid-sized hospital that they use in a year, it contributes about the same greenhouse gas emissions as up to 1,200 cars. If you're familiar with desflurane has a global warming potential that is 20 times greater than alternative gases. And it's also the most expensive anesthesia gas that's in use. Advocate Aurora Health actually reduced their anesthetic gas emissions by 75%, and they saved $1.6 million by effectively using substitutes for desflurane. If you have centrally piped nitrous oxide in your facility, it's extremely problematic because most of those big tanks that we've seen is lost to the atmosphere prior to ever being used because of continuous leaks. So instead, decommission the centrally piped nitrous, and where it must be used, substitute portable tanks that can be turned off when they're not in use. And that eliminates a huge amount of your scope 1 emissions. And then whatever gas patients get, they breathe it in, but only about 5% of it is actually metabolized, and the rest is expelled into the atmosphere. Waste gases are usually vented up and out through the roof, but there are capture systems, and these trap the gases, and I include them as a recommendation as part of climate smart clinical care. Metered dose inhalers contain propellants that have greenhouse gas emissions. And so shifting to lower carbon inhalers, such as dry powder inhalers, when that's clinically equivalent for patients, is one opportunity. And there's a lot of research work being done on inhalers right now to come up with different substitutes. Also increasing the frequency of the greener disposal of used inhalers is a big part of avoiding greenhouse gas emissions in the disposal phase. And just supporting innovation. We talked about working with your supply chain. This could be an area to work with on your supplier of inhalers, to ask them what they're doing about creating and making available to you cost-effective and high-quality inhalers that do not contain greenhouse gas propellants. And then let's talk about reusable supplies and equipment. These reduce greenhouse gases that are created in the manufacturing, in the packaging, and the disposing of disposables. And one example, which had to do with a shift to reusable isolation gowns. This is something the UCLA Medical Center did, and they diverted 300 tons of waste from landfills over the last few years, and they saved $1.1 million by switching one thing. They switched to reusable isolation gowns instead of disposable. So just think about that one occasion and the big result that they got from that. And as you can see, with changing out from desflurane, moving away from disposables, I'm focusing on those that save a lot of money because they also are smart business decisions. They're not just smart climate actions. And now let's talk about these additional clinical efforts that you can take. So reprocessing and remanufacturing single-use devices. I don't know how many of you have that occurring in your practices right now, but the FDA approves, they have approved protocols through which you can take devices that are, some devices that are labeled for single use only, and reprocess them or remanufacture them and bring them back into service until the maximum number of cycles is reached. Thousands of items can be safely reused in this way, and it saves money. A large hospital can save $1 million a year if they reprocess all of the eligible items. And this is the important part, purchase back the reprocessed items. It's one thing to send them off for reprocessing, but you have to purchase them back to get that circularity, and that reduces greenhouse gas emissions. One of my favorite topics is to mention low carbon food. And food actually comprises 12% of the total healthcare sector greenhouse gas emissions, surprisingly high amount. So what can we do to think about food as a climate smart strategy? Well, first, reducing meat consumption. This doesn't mean eliminating meat, but reducing it is a powerful way to reduce emissions, and it benefits health. We know that diets that are high in meat consumption can result in a variety of health concerns, and those can be mitigated right along with reducing greenhouse gas emissions. So things like Meatless Monday and cafeterias are one of the strategies that are used. There are a couple of resources around food I'll just mention. One is called the Cool Food Pledge, and that means committing to a target of reducing greenhouse gas emissions from food by 25% by 2030. And this is by shifting toward more plant-based diets. So taking the Cool Food Pledge is something that a lot of hospitals have done. And another pledge is called the Healthy Food in Healthcare Pledge. This is something that's run by Practice Green Health, which is a membership organization for healthcare, and hundreds of hospitals across the US have signed on to that pledge because it's a way to signal the marketplace about their interest in procuring local, sustainable, nutritious food. And let me also bring up food waste here, because eliminating food waste in patient food can be done through room service models, which you may already be employing. That's where patients order their medically appropriate food when they want to eat. For catered food, many communities have food rescue organizations that get leftovers and get them to people who are food insecure. And then finally, on-site or contracted composting of food waste eliminates greenhouse gas emissions. So those are all the things related to food. And let me then talk about moving away from single-use plastic. So nearly every piece of plastic begins as a fossil fuel. In fact, 8% of the world's oil production goes into making plastics. And with the drive toward renewable energy, the fossil fuel industry is actually doubling down and shifting the direction of oil and gas from energy to plastic, because that is a very promising opportunity. And they've targeted healthcare in particular as a place where many more single-use plastics can be sold and utilized. So when you stop using single-use plastics, you are reducing the fossil fuel impact of that and making huge reductions in greenhouse gas emissions. So this is my last slide, and I want to talk about, as clinicians, how you play such an important role in this climate smart world. You are trusted messengers about the science of climate change and the need to take meaningful action now. You also have the ability to help communicate to people that, yes, actions we take today are important, they're crucial. There is no magic pill that's going to solve climate change. This requires action at the individual and community and global level. And you can be a messenger, an important messenger for that. You have the moral agency to address a global health crisis and its deepening inequities. And in addition to being trusted, you have that moral ground where you have every right to speak on this topic and speak as forcefully as you can. And decarbonizing healthcare can have significant benefits to the broader economy. Current commitments are insufficient, radically insufficient. For all of the great work that we see out there, it is nowhere near enough. And we need to really step up our game, and you can be very much a part of that. You know, I mentioned earlier that climate change has a multiplier effect. It worsens existing health conditions and inequalities. In the same way, I think if climate change is a multiplier of health conditions, the healthcare sector and clinicians can be multipliers of solutions. with speaking out and speaking in a unified way and being steeped in science to educate communities and patients and colleagues, all of that, you can be multipliers of solutions. So my request to you, a call to action, is to mobilize your power and your leadership, much as you are through this group that's convened today. Support your health system in adopting a zero carbon target, in measuring their emissions, and in adopting an effective plan that they execute to reduce greenhouse gas emissions. That will help lead changes in areas that are ripe for decarbonization. Anesthetic gases we talked about, reusables, ending single-use plastics, low-carbon food. These are all efforts that have been well documented. There are all kinds of tools out there that make it easy, and you can help ensure that where you're delivering healthcare, these kinds of actions are in place. So really, doing less than our best is not an option, because then for sure there will be a worsening calamity. So we can be catalysts for this change, and I urge you to take that role and be a catalyst for climate smart healthcare. And with that, I can turn it back over to Dr. Sims. Thank you all very much.
Thank you so much, Kathy. As outstanding as I expected it to be, I really appreciate your outstanding work in this field, and want to encourage everyone to get a copy of Greening Healthcare and read through what really is, to my mind, the penultimate book on how this process works. It's sort of the best explainer that covers all the topics we deal with in healthcare, which are extremely broad, but in a way that makes it easy to comprehend how to act. And I think I've found, and many others have found, that action is the best way to fight that climate anxiety that we're all starting to feel. The first question I have for you, Kathy, is about your book. I really feel like it is such an outstanding framework for how this problem should be approached. And I wonder, since this was published in 2015, if you have plans to update, given all of the new technology that's constantly bubbling up, because I would love to see this be really the textbook going forward for how to do this, and continual updates, allowing us to see kind of new tech and new ideas.
Well, thanks for that so much. I actually do not have any immediate plans to update that book. It does need updating for sure. What I can let you know is that there are, there's so many different areas within this work, and there are great resources on things like green hospitals, and there are a lot of tools around things like shifting away from desflurane. So there is much written that's out there about these things. There's also something I should, and I'll try to put a link for this in the chat. The AHRQ, which is the Agency for Healthcare Research and Quality, they, along with the Institute for Healthcare Improvement, IHI, just released a very readable compendium. It's about 40 pages long on how to decarbonize healthcare. And let me just drop a link for that in the chat, because as a short document that says, here are the items to hit now and how to go about it, I recommend that as a resource. And let me just throw that in the chat now.
Yeah, that action plan from the organization you mentioned, AHRQ, is really readable and very interesting too. I'm going to ask another question or two, and then I'll, if you guys in the audience have questions, please send them to us and we'll get them to Kathy. But I'm going to steal some time and ask another question or two of my own. So in terms of structuring a healthcare organization to achieve these goals, what do you think is the ideal structure for this setup? In my experience in looking at this, it seems like in addition to a motivated core group of leaders from the workforce, we need good executive sponsorship to really push these programs to success. And I guess the next part of that question would be just how aware are healthcare executives of this issue? Are there national conferences or meetings where healthcare executives are learning about this? And how can we identify the executive leaders in our system to be champions in our mission?
Yeah, so maybe first I'll take that latter part, which is are there groups out there that are trying to educate executives? And that answer is yes. The National Academy of Medicine has a collaborative on climate and health that's been active for more than a year now. And it is bringing together leaders and lots of organizations and agencies to work together to do exactly what you're talking about, promote climate action within the healthcare sector, starting with leadership. The American College of Healthcare Executives just had their virtual conference last month, and they had a featured session on climate action targeted to executives. And the AHA has they do a survey every year of all of their membership. And this goes to hospital CEOs around the country. And for the first time this year, they included questions about the action that those executives are taking to address climate change. And are they measuring greenhouse gas emissions? And do they have plans in place? So just in the last year, you can tell from AHA, from National Academy of Medicine and others that the attention on this issue is certainly on the rise. When you talked about what kind of structure, I mean, every organization is different, and I think the best structure is the one that's going to work. But what I have found is that really three things are important. One is that there has to be senior leader action and commitment on this. That's why the first thing I mentioned is to set a net zero target. That has to be set at the senior level of the organization. And it has to have the attention and approval of your governing board or advisory board, whichever the largest leadership group is. Anything short of that means that work is going to fall on people that don't have the backing of their leadership. And it will always be something they do on the side as opposed to anything they can be centrally accountable to do. So starting with adopt a zero emission target, 50% by 2030, and get that at the leadership level, that's essential. Once you have that, part of making that commitment at that senior level is they should identify one senior executive. If it's not the CEO, it should be someone who reports to the CEO directly, and that person should hold full accountability for making sure that you understand your emissions and that you're taking appropriate action to meet the zero emission target. And then in terms of structure for how the work actually happens, I've seen a lot of success in getting a team together that has representatives from all these key areas. So you want your facility folks, engineers, operations teams. But for things like anesthetic gases, clearly that has to be led by the chief of anesthesiology and their partners. So getting the right people, getting the head of nutrition on, because food is going to be an area of attention. As you focus on the areas for action, getting the person who leads that work at your facility to be a member of the team so that together they recognize that all of them have a role to play and it embeds this work in their actual job. So it's not like you have a sustainability person leading the green purchasing. You have a purchasing person leading the green purchasing that gets embedded in their positions. You have your EVS teams doing the waste management and dealing with food waste. So embedding it into that work, your folks like Stephanie are brilliant as consultants, as people to help make that work successful and help lead it, but it must be led by the people who actually own that accountability. And through that kind of team effort, I've seen a lot of success. as long as they always have their leadership backing to be able to do it. That's why that structure of governing board, senior leadership, identify a key executive, spread it out through the organization's ongoing structure can make this work actually occur and get reported. And maybe I'll just, one more point that I touched on earlier, but I do think it's key for greenhouse gas emissions and the work here to show up on leadership dashboards. And if it can be tied to quality care, that's very powerful. But also to show up on operational dashboards that have to do with, as they look at profit and loss and those kinds of things, to have greenhouse gas emissions show up there so that it's front and center for the leadership of the organization.
Wow, great. Thank you so much for that. I really appreciate it. Kind of a somewhat follow-up to that. Is there a way we can know what healthcare systems are doing to work towards this science-based target you talked about? Is there like a framework for healthcare organizations to publicly declare their commitment to this goal that's so needed?
Well, many are doing it through the standards and tools that are available globally. So it's great to be able to use the same tools and structures that are used by the supply chain and others around the world. And so first, there's something called the Science-Based Target Initiative. They are mostly for publicly traded companies. They don't have an avenue for nonprofits like nonprofit hospitals to actually get certified through them, but that's okay. What it means is, though, for a hospital or a hospital system to adopt a target and make it aligned with the Science-Based Target Initiative, that's very powerful. So understanding what that initiative is, looking at how to be aligned with it, and creating a goal that is aligned is a way to say this goal is appropriate. Secondly, measuring emissions using the greenhouse gas protocol is essential. That's the global standard today. It's not perfect, but it's the global standard. And if you're measuring your emissions in line with that, then your reports can be trusted. And this is a way to avoid greenwashing. The other key point for avoiding greenwashing is to have your emissions, at least your baseline emissions, and as time goes on, any big changes that happen in the organization, do another one, but have your emissions third-party verified. So if you adopt a science-based target aligned with the Science-Based Target Initiative, if you use the greenhouse gas protocol, if you get your emissions third-party verified, and then you disclose them publicly, this can be on the facility's own website, or it can be through something like the CDP, which stands for the Carbon Disclosure Project. That also is a global standard that many, many suppliers use to disclose their emissions, so that they don't have to tell every customer. They just tell their customers, go look for us on the CDP, and that's how you'll know our emissions. Hospitals can do the same there, but posting it on your own website is also fine. But again, key to have it verified, use the protocol, have a science-based target, and then you can be really well equipped to know that what you're doing will stand up to scrutiny around the world by anyone looking at your efforts.
Great, thank you. A few other questions. We've had some requests for you to come speak at other locations, so I think you've touched a nerve. One specifically from Boise State's nursing school. I think it's really important that we make this part of medical education going forward. I know Melissa Roop from the Full Circle Health, the Family Practice Residency Program, is on the call, and Melissa is working on establishing a residency training program, or a part of their curriculum that focuses on climate and its impacts on health. Do you see other educational systems following suit? Do we see this in medical education, in nursing education, anywhere else along the line that this is being taught?
A lot more needs to be done there, but there have been some important efforts just even in the last couple of years. So some medical schools are featuring the topic of climate. I think what's nice about the story right now is that the medical schools are needing to meet the requests of their students. And it's the medical students who are saying, how are you going to let me make it through my medical education without a focus on the most important health issue of our time? And so it's really in response to student demands and needs that the medical schools are beginning to build it into their curriculum. One other thing, not so much for medical students, but there is a consortium. It's called the Medical Society Consortium on Climate and Health. And it's comprised of all the medical societies. So for, if you're a pediatrician, if you're, an endocrinologist, your society probably has adopted some sort of policy statement around climate change. It's very widespread. And this consortium, again, the Medical Society Consortium on Climate and Health, brings all of them together to try to standardize some of the education and the work being done within each of those societies. So I would encourage you to look to your own professional society and then to this consortium.
Question from the audience: what hospital or hospitals are making strides in the US and have made commitments to lowering their emissions that could be used as an example for a site to emulate?
The group that I'm doing some pro bono consulting with, Healthcare Without Harm, they have a healthcare climate council, and that council is made up of 20 health systems around the country that are leading in this area. And all of them have made commitments around reducing their greenhouse gas emissions. They've made great inroads in achieving those. Kaiser Permanente, my former employer, has been a member of that group. And so their success in getting to carbon neutral last year is something that other systems are right on their heels in beginning to accomplish that. So there are many, many success stories. The systems I'm mentioning that belong to this council include, as I said, Kaiser Permanente, but also Common Spirit, Advocate Aurora, Cleveland Clinic, Providence. So again, there are 20. I won't try to name them all, but all of them are doing really fantastic work. And thank you, Stephanie. I see you put in the chat a description of the Climate Council. And if you click on that, you'll also see some documents that they've compiled that provide case studies about what each of them have done in different areas to have success. Like that UCLA case study I mentioned, I think is in there. So that's a great resource, is to look to the council for, and if any of those members are near where you're located, getting together with them and chatting about what's happening in the local area can be a very powerful way. The other thing I'll mention is if you're having trouble getting the senior leaders of your organization to pay attention, getting a senior leader of one of those organizations to do a peer-to-peer conversation. There's nothing better than having, say, the head of Providence talk to the head of another hospital system to have a chat about why an organization like Providence would be so in the forefront of this work. Their representative testified to the Ways and Means Committee recently about the need for climate action in healthcare. That's what kind of leadership they're providing. So very exciting to see that. And they are great resources.
Yeah, and I think the important thing to understand is that all of these initiatives end up being cost-saving initiatives. So it's the triple bottom line that people talk about in sustainability all the time, where you're not impacting patient care, you're healing the planet, and you're also maintaining profits or profitability, which ultimately reduces the cost of healthcare to the patients you're serving. So I think it's really important for healthcare leaders to focus on that aspect of things when they're talking about this publicly, that this is not a money sink, this is a money saver. One last question I'd like to ask you, and then we'll let you go. But I really want to thank you so much for an outstanding talk. I know plastics have been a particular issue that you've been interested in. Do you see viable alternatives to petrochemicals for plastic replacements in the future? There are so many plastic films and plastic items in healthcare that I would love to see replaced. What's coming down the pike?
Well, there is a tremendous amount of innovation and research on that using, plant-based materials for sort of plasticized products that have some of the same attributes that make plastics so popular. But I would say that as long as fossil fuel companies continue to make a profit, a sizable profit by exploiting fossil fuel, and they are, as I mentioned, shifting attention to get more into the plastic business, we'll see the same kind of issue that we've seen with, renewable power versus fossil fuel power. And, following the money means that we have to change the economics of what we do with fossil fuel. And until that happens, we're not going to see a surge in the availability of plastic-like products that are made without fossil fuels. So we really have to get underneath that. But all that said, there are lots of organizations, businesses out there that are chomping at the bit to be able to get the market that the fossil fuel companies currently hold around plastics.
Well, thank you so much for your time and outstanding work in this, both today and throughout your career, Kathy. You are a real healthcare champion and a leader and a role model for me and many others, I'm sure. Me too. And Stephanie says her too. With that, we'll conclude our talk for today. I just want to mention that the Idaho Clinicians for Climate and Health is our state chapter of the Medical Society Consortium for Climate and Health that Kathy mentioned. I put our website link in there. We have monthly meetings, and you are certainly welcome to join and attend. This is an organization that's aimed at all caregivers, not a physician organization, but an organization for nurses and respiratory therapists and environmental services. We have several infection preventionists working with us. So anyone who's got a stake in healthcare, come join us and learn more about it. And if you go to our website, you can find out more about what we're doing and get in touch. So with that, we'll wrap for today. Thank you so much, Kathy, for an outstanding talk.
Thanks so much. Bye-bye, everybody.